Chairman. Thank you to all of our witnesses for joining us as we continue a series of hearings focused on high health care costs. There's really no question that this is an urgent problem. I've heard from families all over Washington State struggling to afford the care they need, and I know my colleagues have heard from families in their own states as well. And we all heard from voters across the nation. This month, as they soundly rejected the Republican approach of sabotage as health care policy. The will of the people couldn't be clearer. It seems they are very tired of President Trump's broken promises and backward steps and blatant gimmicks. And they're tired of the divisive repeal attempts, and they want real solutions to make sure quality health care is accessible and affordable. They want to know that breaking a bone is not going to break the bank, that a high fever won't come with a high cost, that filling a prescription won't mean emptying their savings account, and people want to know that when a loved one is fighting a life or death illness, they can focus on getting healthy, not getting out of debt. That's why they want Congress to come together in a bipartisan way and work together on plans to bring down health care costs. Today's hearing is a great opportunity to do that as we explore how innovation can help address this challenge. One part of the equation is innovation driven by employers. So I'm really excited to hear from King County Executive Dow Constantine, who's with us from my home state of Washington, about how they have been tackling this. With 15,000 employees, King County is Washington State's 13th largest employer. In order to help drive down healthcare costs, the county has partnered with their local healthcare system and other employers, developed a wellness initiative, and focused on shifting to value-based care purchasing. But the county has also taken unique and innovative steps to keep employees informed of these efforts and approach them as partners in making healthcare more affordable. Their success shows cost-saving innovation must be joined by education and engagement so people understand how they can benefit from new programs and initiatives. So I look forward to hearing from you, Executive Constantine, and thank you for being here. Another critical part of the equation is provider-driven innovation, which is why I'm glad Dr. Perlin is here today to share his insights. Dr. Perlin has led projects to improve quality at the Veterans Health Administration and in the private sector, so I know he will also have valuable lessons to share today. And as we focus on this topic, we shouldn't forget that Congress created the Center for Medicare and Medicaid Innovation. It's a laboratory for trying out new ways to deliver health care to help public programs and the private sector innovate together. Now, unfortunately, instead of supporting this lab of innovation, President Trump has been working to undermine it. He proposed rescinding part of its budget in his failed rescissions proposal, but luckily, as we know, Congress came together to reject that. Or when he delayed and even canceled sensible demonstration projects meant to encourage providers to keep costs down and deliver the best results for patients. Recently, he also warped the 1332 waivers. It's a tool Congress intended to help states innovate, so they encourage states to sabotage health care protections instead. It seems like the only innovative thing about President Trump's health care strategy has been his sabotage. He has, as we know, slashed investments, shortened enrollment windows, expanded junk plans, and undermined protections for people with pre-existing conditions. And when Congress, including many of us in this room here today, got close to passing a common-sense solution to repair some of the damage and bring prices down, that was sabotaged as well. But, Mr. Chairman, I'm really hopeful that we can revive discussions in the new Congress and find a way past the ideological standoffs of the past. It is long past time this came to an end, and voters have made it clear that they agree. We saw in the midterms exactly what we saw before Trump Care went down in flames, people standing up. They make their voices heard. They send a strong message that the Republican strategy of standing aside and giving President Trump free rein to undermine health care is taking us in the wrong direction, which is why I'm very glad we are sitting down here today to look for bipartisan solutions that will bring down costs for patients, families, businesses, and governments. And I hope Republicans got the message, ready to turn over a new leaf with us, and agree that repeal is off the table, and finally agree we should be holding President Trump accountable for sabotage, and importantly, working to repair it. And I do hope we can all get back to the negotiating table to hammer out a plan for problems we were sent here to solve. Democrats are here. We are ready. We have some promising ideas where we hope we can find some common ground. ideas to repair the damage that has been done to drive up prices with Sabotage, ideas to address the surprise balance billing so patients aren't caught off guard by unexpected and unaffordable price tags for out-of-network care, ideas to lower skyrocketing prescription drug costs so families don't have to wonder whether they can afford the medicine they need, and ideas to give families facing a health scare a bit more peace of mind by making sure that everyone in the country can afford to be healthy. So I'm looking forward to all of our witnesses' ideas on this today, and I'm hopeful that we can join together, taking what we hear today and working to find common ground and pass common sense solutions. Thank you, Mr. Chairman.
Thank you.